Activa LT, ResMed Activa LT, has the name ResMed there, and the Activa LT name is on the cushion, Mirage Activa LT. It comes in a small, medium, and large. As you can see, the forehead cushion is rounded, so it doesn't create pressure points on your forehead. It can come off, it pops off. Just push it back in the hole, this hole. It has a knob here for raising the mask up off the bridge of your nose. Not a useful function on this mask. What that ends up doing is putting this flap in your mouth, very annoying, and it doesn't allow the mask to be as flexible. It's a very flexible mask, and it will blow out and suck on and seal, and you move around and stuff, and it just creates its own seal. But when you raise it up with this knob, you make it difficult for the mask to do that. So I find that it's not useful. It's more problematic to turn that knob. Most people leave it completely flush to the bottom. If you are going to raise it at all, it would be because this part of the mask in the corner is creating a sore on the side of your nose. And for that reason, just 1, 2, or 3 clicks should do the job. Otherwise, leave it flush. There are holes in the front that allows the carbon dioxide to blow out. So when you're wearing it, you will feel air blowing out here all the time, and that is a good thing. Don't duct tape those holes. This piece is the quick disconnect. Sometimes it gets lodged in the tubing, and then you try to wear a different mask and say, well, this doesn't work with my tubing. No. It's just that the quick disconnect belongs to this mask. So make sure you keep that piece with this mask. You'll notice on the very bottom that you have oxygen port holes. These things can come out. Don't take them out on purpose, because the more you take them in and out, the more loose they become, and then in the night they will pop out on you, and a whole bunch of air will leak out of these holes. Very loud, drying, and a little suffocating because it's just too much air blowing in your face. So, for cleaning, you push the 2 blue tabs to pop it out. Grab the cushion, take out the frame. Wash your cushion daily. Facial oil will make this leak more. So turn on the warm water, put a dollop of dish soap on there, wash and rinse, and leave it to air dry for the day. This mask is quite nice because it has 2 layers here, so the air gets in there and creates a bubble seal, so it doesn't have to be tight. Once you're done cleaning, you put it back together again. You'll notice that the frame should go in like so. It doesn't work very well, it doesn't work at all, if it's not in the right way. It has to be, this bottom part runs along the bottom and has the short end, the short tab, and then the 2 side ones have the longer tabs. So it has to be in that direction, and it sits very nicely like that. When you put it in, you'll notice there's a ridge here. Start with the nose up top, putting it in that ridge, and then work your way around, popping it in. Now, if you put it in too far, this little ledge here needs to be below the cushion all the way around. Otherwise, if you put it in too far, where the ledge, see right there, the ledge is missing. Now you have a mask leak right there, and it's just horrible. So make sure you put it properly inside of the rim. Put it back on the frame. You set the 2 tabs in the two slits. Just brace it like so and give it a squeeze, and that will pop it in nicely without pulling your cushion off the frame. Don't forget to do the bottom one. Big squeeze, and that pops that in very nicely. Now the headgear has the clips that you squeeze this part in the center, and you just push it in. But to get it out, you push this part. So sometimes people get confused about which way should the headgear go, you know, after you wash it. It's like, oh geez, I don't know how to put it on there. So what you do is you look at the name of the tag and set that down on the table, upside down. And then fill it out. If you see an upside down triangle here, you have done well. Set the mask in the center and attach the straps. The top straps will never have to be tight. If you're making it tight, it's really not for a good reason at all. I've never has anyone had to make the top tight if this was a properly fitted mask for you. You just need to make it snug to anchor it to your forehead to provide the stability of the mask. The rest of it's going to float and move a little bit, but it just needs a little stability. And so you just make it snug. The bottom straps you'll make just tight enough to get a little of the bounce out of the mask when you're breathing in and out, but basically you don't need to wear the bottom straps tight either. This mask should just suck onto your face and create a perfect seal without any leak issues anywhere. To adjust the mask, the lift off reseat doesn't work. Lifting off and reseating it is a moot point. So what you do is you do the tug. You grab this corner and give it a tug and then let it pop back onto your face, and then this corner and pop back on. Don't do both sides at once or it will ride up your nostrils and it'll leak by your nostrils. You need to do each side independently. Just a little tug. It's a large mask, but it's a light mask and it seals well. I rarely have heard of anyone having any sore on the bridge of their nose. This mask works great for people who have a large nose or a high arch on the bridge of their nose. It is a good mask. And you can replace the cushion by itself. So you don't have to replace the whole mask all the time. And it is the cushion that wears out the most. You can also replace the headgear by itself. And that is the ResMed Activa LT mask.